you, I just wanted to introduce some exercises or movements that I do with my clients after their first session. I think it's important to give some homework so that way you have some at-home tools that you can practice, so that way when you take your next session, you're a little bit more well-versed in where where you need the most work, and you don't have to spend so much time in that session working on those, things, because you've already been practicing. So all of these movements that we're about to do are fundamental and safe for just about anyone. So let's get started with lying down on our back, working in neutral pelvis. So neutral pelvis is where you have a little bit of space in your low back where you can kind of bring your hand underneath, right? You don't want it arched and you don't want it imprinted. So you want to be able to at least bring your hand underneath your back, and you want to make sure that your hip bones are level with each other and level with your pubic bone. The shape of a diamond with your hands. Place them right on your pelvis so that the pubic bone is where your fingers are and your thumbs are where you're right underneath your navel. Pubic bone to be pointing up towards the ceiling or down towards the floor, right? Not up and not down. Those lumbar multifidi are very important. We have the multifidi all the way up the spine, and they help lift the vertebrae up off of each other so that we're not, compressing on those vertebral discs. When that starts happening, that's when we start getting, back pain, nerve pain. So what we're doing right now is just setting you up for success. We don't understand really what the core is made up of, and we think it's just the abdominals, but it's also the lower back. So that's why we have the lower back slightly lifted off of the mat, because we want those muscles to be engaged. Not where you're arching and you're, popping the ribs forward, but you want to just be mindful of what the natural curvature of your spine is. And then with that space and with your hip bones and your pubic bone level with each other, your feet are also sit bone width apart. So we don't want to have them wide, we don't want to have them together. We want them about sit bone width apart. So that way we can anchor them down and also just find some width in the hips. Pelvic tilts, okay? So we want to make sure that when we start in this neutral, we have work in the abdominals, and we have work in the lower back. We're going to take an inhale into that neutral, and then we're going to exhale, and we're going to lift our pelvic floor. So you're going to lift your insides, you're going to feel an engagement of those lower abdominals, and then you're going to draw your belly button in towards the spine, and then just imprint your lower back onto the mat. And then you'll inhale, let's go back to neutral. There's a little bit of space. You'll exhale and you'll draw your pelvic floor up. So you're going to lift your abdominal contents up. Draw the belly button in towards the spine and then imprint the lower back. Let's do about, I'd say 10 of them. So we're just going to exhale and we're going to draw our abs in and we're going to just slowly tilt that pelvis and then go back to neutral and tilt the other way. So as we're tilting or imprinting, it might be a little bit of tucking, right? We're exhaling. Inhale, you work those lower back muscles. Exhale, you draw your abdominals in. I'm also being mindful about my arms, my hands. I'm definitely pressing them into the mat, and I'm mindful of my spine from the cervical all the way down to the lumbar. So I want that alignment, and I want that engagement of the abdominals and that awareness of, drawing the ribs closed and trying not to pop them when I lift my lower back. Because your lower back is the same curvature of your neck,
there is a tendency to want to do this. But what we're doing is just focusing on those core muscles, right? Exhale, pull everything in. Inhale, lift the lower back off the mat. Now after you've done about 10 of those, you really want to just kind of just rest in that moment and just kind of see how you feel. Do you feel like one side of your lower back might have been working more than the other? Or do you feel like, you know, maybe we're having trouble with the pelvic floor or the transverse abdominals? Or maybe it's the breathing, maybe the diaphragm, you know, you're trying to figure that out. You're not gonna after your first session, it's not like you have all of these things figured out. It takes some time, it takes some practice. So, you know, you just wanna be patient with yourself. And you don't have to have all the parts figured out, but I just think just getting the movement is key here. Just trying to focus on this lower area working, your pelvis moving, and your abdominals drawing in and releasing those muscles. Engaging, relaxing.